Good morning, everyone. We'll get started in just a second. Are we live on YouTube as well? It seems so. Okay, I'm going to assume everyone can hear me okay. If not, please let me know and I will work on fixing that. All right. So good morning, everybody. Again, thank you for joining us on this press conference about the COVID-19 outbreak inside of Santa Rita Jail. My name is Amber Akemi Pyatt. I use she, her, hers pronouns, and I'm the director of the Health Instead of Punishment program at Human Impact Partners, or HIP. HIP is a national public health organization headquartered on Ohlone lands in Oakland, California, and we are proud to be part of Decarcerate Alameda County. So first, some housekeeping. Journalists and other members of the media are welcome to join us on the Zoom line that was provided on our press advisory. We will be taking questions from members of the media who are on our Zoom room first. Members of the public are welcome to tune in on the Ella Baker Center's YouTube page, where we are simultaneously broadcasting live. Their page is youtube.com/Ella Baker Center. And we will also try to take questions from the public on the YouTube page, time permitting. It seems like somebody might be off of Zoom or off of mute on our Zoom. If you could mute to avoid background noise, that would be great. Okay. And finally, this press conference will be archived on the Ella Baker Center's YouTube page, and a link will be publicly shared on social media if you are unable to attend this whole press conference live. I also want to note that this press conference is being hosted by Decarcerate Alameda County. If you are unfamiliar with our work, Decarcerate Alameda County, or DAC, as some people might refer to it on this press conference, is a large and growing coalition of grassroots groups, nonprofit organizations, and concerned community members. Our core priorities include freeing people from Santa Rita Jail, divesting from incarceration and policing, and investing in community health. Decarcerate Alameda County is led by a steering committee that includes 67 Sueños, American Friends Service Committee, or AFSC, the Anti-Police Terror Project, or APTP, Communities United for Restorative Youth Justice, or COURAGE, the Ella Baker Center for Human Rights, Human Impact Partners, or HIP, where I work, the Justice Reinvestment Coalition of Alameda County, Moms for Housing, and Restore Oakland. We are also live tweeting from our Decarcerate Alameda County Twitter page, which you can find with the handle DecarcerateAC. One second. Okay, so today we'll be hearing from family members and advocates discussing what the current COVID-19 outbreak in Santa Rita Jail means for public health and racial justice in the county overall, as California approaches its 30,000th COVID death during our worst COVID surge yet. So for those who are unfamiliar, Santa Rita Jail is the 5th largest jail in the country. It's what's known as a mega jail, and it is run by the Alameda County Sheriff's Office in the San Francisco Bay Area of California. Okay, sorry, managing some of the back end things as well. I want to make sure everyone can hear me okay as I keep going on. Okay, so I think it's really important to contextualize this outbreak within the long, sordid history of abuse against criminalized, detained, and incarcerated people. In particular, the Alameda County Sheriff's Office has long been plagued with scandal. From forcing a pregnant woman to give birth alone in solitary confinement, to collaborating with ICE and continuing to collaborate with ICE, to creating anti-Black and Islamophobic training exercises as part of a militarization program and weapons expo called Urban Shield that community members successfully ended, to just last summer, pressuring the Oakland Police Department to use tear gas against people who were rising up to defend Black lives, to amplifying white militia groups like the Oath Keepers, whom ProPublica and Frontline just confirmed were part of the attempted coup by white nationalists in Washington, D.C. last Wednesday. And now, of course, we must add the Alameda County Sheriff's Office mishandling of the COVID-19 pandemic to this long and growing list of scandals. So while the Alameda County Sheriff's Office is perhaps an extreme manifestation of broader patterns of police abuse and harm, Santa Rita Jail certainly is not alone. Unfortunately, we have seen that jails, prisons, and ICE detention centers are hotspots for COVID-19 all across the country. This should come as no surprise to those who understand the inner workings of carceral facilities. They are designed to be inhumane. They are characteristically overcrowded, offer inadequate health care, provide rotten food, force people into unpaid or underpaid labor, isolate people from their loved ones, and wreak havoc on families and communities. This was all true before the pandemic, which is why directly impacted folks, legal scholars, human rights groups have long been ringing the bell that incarceration is a public health crisis. And this year, the largest public health association in the United States, the American Public Health Association, or APHA, also recognized incarceration as a public health crisis and recommended prison abolition as the primary solution forward based on available public health evidence. And of course, the consequences of these conditions are far more acute, devastating, and life-threatening in the context of this COVID-19 pandemic. New research from the Prison Policy Initiative exposes the extent to which incarceration and detention have driven COVID-19 cases, not only within carceral facilities, but also in communities throughout the country. In Alameda County, for example, the report authors estimate that over 2,500 confirmed COVID-19 cases in the county between May 1st and August 1st alone are attributable to mass incarceration and detention. Unfortunately, we anticipated this. In March, over 50 local organizations, including public health leaders, faith groups, legal service providers, submitted a letter of demands to the Alameda County officials. Our demands have yet to be fully met and were largely in 4 buckets. That Alameda County must stop incarcerating people. No new people should be entering Santa Rita Jail. That Alameda County must decarcerate Santa Rita Jail. They must release people who are currently inside because of how unsafe it is to be inside of jails right now. Third, that the Alameda County must meet the immediate needs of people who are incarcerated while we actively prioritize decarceration. And finally, that Alameda County must invest in the assets that make our community healthy. There have unfortunately been several outbreaks within Santa Rita Jail since we sent that letter in March, including one right now that began on December 23rd. On that date, active COVID-19 cases in Santa Rita Jail increased from 5 to 53. That's a 1,020% increase overnight. Now, weeks later, cases are over 76. And despite this, COVID-19 testing still rarely hovers over 15% of a jail population that is increased back to pre-pandemic levels. We saw many releases in the weeks following the state of emergency declaration, but we are unfortunately seeing jail levels back at pre-pandemic levels now. You can see the latest data at bit.ly is bit.ly/ and then all caps SRJ COVID-19. And I can chat the link to that as well. So with that, I'm going to turn to our first speaker. Let me just make sure logistically we are fine. And okay, so I'm going to turn to our first speaker, Sheila Dunlap. Sheila has a family member who is currently incarcerated in Santa Rita jail, but her family has long been impacted by the harms of the sheriff and the jail. So I will turn it over to Sheila in just a second to share more about her family's experience. And as a reminder, you can submit your questions in the Zoom chat or in the YouTube comment thread, and we will have time for your questions at the end of this press conference. So I will turn it over to Sheila.
Good afternoon, everyone. Can everyone hear me fine? Are you able to hear me?
Yes.
I may know if my speaker volume is up.
Yes, you're good, Sheila.
Yes, I would definitely like to talk about the COVID. I do currently have a family member that is incarcerated at Santa Rita, and my sister, more so. She's been there now since I think November is when she actually arrived at Santa Rita, where she was required to go under a 10-day quarantine. And after she was quarantine free and COVID free, they actually moved someone into her room directly off the street into her room without being quarantined or anything. And she questioned it, and they ignored it. Um, and it happened actually on two separate occasions. And she's actually asthmatic, so our concerns are more, towards that, since she would be more susceptible to actually get COVID because of her asthma. And she asked for cleaning supplies, clean her room, and to no avail. They didn't give her anything to like clean properly. And then more so of actually taking someone directly off the street and moving them into a cell with someone who had already been quarantined that was COVID free. So that was a big issue and concern for me, on top of everything else that she's been going through while there. Namely, the food as being cold, stale, expired. And that is mostly what everything is all about. That's been going there, with the COVID. It's kind of hard to fight something that is so strong as the COPA, the Police Officers Association. We fight and fight, for the rights of everyone. Just because they're there doesn't mean that they're not human or that they're inhumane, but they treat them like they're nothing, like if they're dogs or they don't have family. I mean, animals are treated better than the inmates and the people that are actually there at Santa Rita. I don't even know what else to say besides it's just like, it infuriates me, for that to happen when we're in a pandemic and they're not even waiting for a cell to become, clean to, I don't know what the actual time frame is as far as the cleaning, but I know there's supposed to be a process on cleaning and how it's supposed to be kept, and they're not obeying by that whatsoever. It's just, it's heartbreaking. We can do what we can here, but as far as keeping everything clean, but what about the inmates that are there? They don't, they're at the mercy of the officers, so to speak.
Thank you, Sheila. I wonder if you might want to comment at all on, of course, conditions in the context of this pandemic are really terrible, but we know these are longstanding issues, and anything you'd like to share about sort of pre-pandemic, how what we're seeing today is a continuing part of this pattern of abuse at the hands of the sheriff and the jail.
I would say before COVID, situations were extremely bad. I know, say 20 something years ago, I had a friend that was there who I believe had gallbladder or gallstone issues. She reported it to the officers or to the staff. They ignored it. Where at the end, they had to take her out for emergency surgery because she almost died of poisoning inside of her body. But they didn't believe her that when she said something was wrong. So she was at, Highlands, for God knows how long. But, she almost died there because they didn't believe her, about what was going on with her. People come in there, I understand, drug addicts kicking or or whatever the case may be, but they still don't take it seriously. They figure that everybody's a junkie, everybody's on drugs, everybody is lying. If you go to jail, you possibly can't be ill, or that you're playing on on the court system or judicial system. And that's not true for everyone. Everyone, it's not like that, even though granted there are some that are out there that will play on the judicial system to get what they need or what they want, but everyone there is not lying. And they sit up there and was like, oh, well, she's lying or he's lying, or they'll just ignore it, but how many deaths have been swept up underneath the rug and as cover-ups, because of it, for prime example, I'm related to Dwan Armstrong, and it was sad on the situation with the young man, that was just there for weekends. I have a grandson that will never know his father because he was taken away. And watching the video from the officer's cam was heartbreaking, where he was sitting up there saying his name and please help me. There was one officer that was there that was, trying to keep control of the situation. But if somebody's out of their mind and that, they're not right, the unnecessary force that was used on the young man wasn't necessary, especially when someone is handcuffed from behind and you have 4 or 5 officers that are there. So you're just going to jump and beat him for what reason? What harm was he, to them? He was more harm to himself than anything. And then for you to want to sweep it up underneath the rug or say it was a drug overdose, no, it was not. The officer that kneed him in the back of his neck broke his neck. He was dead on the gurney before he made it to the nursing station. So anybody with eyes that watched the video, because I've watched it on more than one occasion, can see what happened. So it's just sad and it's unfair that, that did happen. And it's happened to numerous other people as well that don't have families to speak on their behalf, that there's nobody there for a support system. So I'm so glad that this organization is here to kind of, shed light on what goes on there, how inmates are being treated, because they're people still at the end of the day, but you have these officers that want to use their power, but if something happens, say if John has a DUI and it results in a death where he runs into somebody else, they're going to, give him a slap on the wrist and give him administrative leave, with pay and no other penalty, saying that he's in a stressful environment or he's in a stressful job. They knew that before they started. They knew what the job detailed before they signed up. Unlike us as parents, we don't get a handbook that tells you how to be a parent or how to go through life. Everybody has their own demons or situations that they go through. But if you and I were to have a DUI that resulted in a death, we would be in jail. We wouldn't get a slap on the wrist and say, oh, well, life stressed her out. So she was under the influence because life stressed her out. So we're going to give her a break and let her continue to work or with pay to help her out. It doesn't happen. So when you're part of that organization, you're kind of so protected, hedges are around you and they cover you. They protect their own at the same time. So it doesn't matter what wrong they do, they're always right. So how do you go against and fight something of that magnitude that is almost larger than life, so to speak?
Thank you so much for sharing all of that, Sheila. It's so important to stay rooted in the experience of those who are or have been incarcerated in Santa Rita Jail in this work, including those who have tragically and unnecessarily died in custody. I do want to uplift the names of Dwan Armstrong, Christian Madrigal, Raymond Reyes Jr., and countless others who should be at home with their families right now, but instead were killed by the Alameda County Sheriff's Office inside of Santa Rita Jail. May their memories be a blessing.
Yes.
Next, I would like to introduce Lina Garcia Schmidt with the National Lawyers Guild, the San Francisco Bay Area chapter, which offers a free hotline to anyone who would like to discuss the coronavirus or conditions inside of Santa Rita Jail. For those who aren't familiar with this, the hotline is reachable at 510-925-4060. Again, want to share this because it's a resource not many people know about. That number again is 510-925-4060, or by email at srjsolidarity@nlg.org. Though it's important to note that hotline workers are not attorneys, so folks inside who are calling should not be planning to discuss any confidential information about an impending case or anything that could incriminate them over a phone line, since it may be recorded. So with that, I would like to pass it to Lina. And as a reminder, everyone can submit questions into the Zoom chat or YouTube comment thread, and we will have time at the end of this press conference to go over your questions. I'll pass to Lina.
Thank you, Amber. So hi, everyone. My name is Lina Garcia Schmidt. And again, I work with the National Lawyers Guild San Francisco Bay Area chapter, where I help to coordinate a hotline for people in Santa Rita Jail. And I also just wanted to emphasize what Amber mentioned earlier about the publicly available database with COVID infections. And the link is in the chat. So I wanted to bring us back to that data, because together, my colleague Darby Iono and I have been working to try to paint a more accurate picture of what is happening inside Santa Rita. Darby, on one hand, by maintaining this publicly accessible database, and then our hotline by taking calls directly from people in the jail who are sick, who are quarantined, or who want more information about their rights during this pandemic. And for months, advocates and incarcerated people alike have been extremely concerned that the increasing population in Santa Rita would lead to an outbreak. And then at the end of December, the active COVID cases increased, like Amber said, by 2,080% in just 8 days. Much of that outbreak was concentrated in a dorm where people are unable to maintain 6 feet of separation between each other. And more than 100 people in those dorms share the same airspace. And dorms right now are being used in part because the jail population is currently too big to house people in cells. So just yesterday, we spoke with a woman who's housed in one of these dorm style units, and she reported to us that last week she shared a single room with 9 other women. So sleeping in bunk beds, people are unable to maintain a 6-foot distance from one another. And some advocates and community members who attended the monthly status hearings that have been convened on this pandemic before Magistrate Judge Nathaniel Cousins will recall that this summer, the sheriff's proposed remedy for this really crowded environment was for individuals to sleep head to foot. So as the outbreak continues, the sheriff and WellPath have slowed down their testing as well, which we're very concerned about. And for example, they've tested less than 10% of the population in the past week, even though large numbers of people do continue to report that they have COVID symptoms, and 16 housing pods have been quarantined during that time. So we feel that soon the sheriff is going to claim, as they have before, that they've controlled this outbreak, when all they've really done is just stopped seeing it. And the publicly available data that has been maintained since the beginning of 2020 confirmed that the Department of Public Health has recommended that everyone in a housing unit should be tested if someone tests positive. But this has not been the case, right? The sheriff has a COVID plan that states that any pod or housing unit that develops a case of suspected COVID-19 will have the index case removed to isolation cells, and the housing unit or pod will be placed on quarantine for 14 days or until testing comes back negative on the index patient. So in other words, the sheriff's protocol allows an exposed housing unit to be released from quarantine based on a single negative test. This has led to at least 5 housing units being quarantined multiple times over short periods of time just in the month of December, because new people are developing symptoms as soon as their quarantine is lifted. And this test-based strategy, we believe, not only suppresses the true amount of positive cases, which we suspect to be much higher, but it also has an enormous impact on people's lives and their mental health. So callers to our hotline have reported that they've not gone outside in months, that people are at a boiling point of stress and frustration after being confined to their cells for nearly 24 hours a day. And despite spending so much time locked up, people are only offered a short 30-minute window each day to clean their own cells. So people often, despite all of this downtime that is causing stress and frustration, people often have to choose between a few essential activities, such as cleaning, taking a shower, calling their families. And that is becoming an impossible choice that has to be made within this really small window of recreation time. And one person said about this, frankly, our spirits are broken. So in this oppressive and unsanitary environment, people also feel that they are sitting ducks almost for this COVID infection, because COVID infection might come either from people who are newly booked into the jail, like Sheila mentioned, that people are placed into cells with people who are already quarantining, which should reset their 14-day quarantine, but doesn't. So they're exposing those people. And people are concerned that they're exposed to infection by deputies who are entering and exiting the jail every day and moving in between quarantined and non-quarantined housing units. So since this hotline launched in the summer of 2020, our callers have consistently reported incidents to us where deputies and staff don't wear masks or aren't wearing them properly, pulled down over their nose or over their mouth. And just in December, right before this outbreak, we were really, really disturbed to hear from a woman in Housing Unit 24 that there was a housing deputy who appeared to be visibly ill. She was coughing, her eyes were watering, and her skin had a yellowish tint to it. And when she was questioned by the inmates, the deputy insisted that her symptoms were just due to having too many energy drinks. And this really disturbed us because this is not the only report that we've heard of deputies who are sick, deputies who are reporting to work and not using their masks properly. And something that is really frustrating to us, both as advocates and incarcerated people, is that the jail's response is often, well, it's a big jail. It's just a few rogue deputies, and this isn't a consistent practice. And frankly, at this point, that is not enough for us. That these practices, the sanitation practices and masking practices, are putting people at risk. The test-based strategy is putting people at risk and causing quarantined housing units to be quarantined over and over. And so we need better answers and more substantive change than just this is a few bad apples. We have everything under control because as we've been seeing, the sheriff claims that they're controlling the outbreak, and what we are really seeing is that they choose to stop seeing it.
Thank you, Lina. I want to uplift this piece that it's not just a few bad apples. This is a systemic and structural problem. And as a public health researcher, myself, I want to uplift the public health evidence, since that's the area of work I'm most familiar with. So there is growing evidence on the harms of incarceration, which is really just confirming what directly impacted folks in frontline communities have been saying all along. So there is public health evidence that incarceration harms an individual's mental and physical health, that incarceration also negatively impacts one's family and community health, so beyond the walls of jails, prisons, ICE detention centers, and that the criminal legal system and immigration enforcement system disproportionately harms people who are structurally marginalized. So that includes Black people, Latinx people, Native American folks, immigrants, people with disabilities, queer and transgender people, unhoused people, people with low incomes, sex workers, and others. So that said, I want to turn to our last speaker, Yolanda, who is a civil rights attorney working with folks inside of Santa Rita Jail, in particular on some current and past lawsuits. I will leave it to her to share the details of that. And again, one final reminder that after our final speaker, we will be turning to any questions that have been submitted in the Zoom chat or Zoom Q&A function, or in the YouTube comment thread. So please submit them there and we can take them after Yolanda. And with that, I will turn to you, Yolanda.
I don't really have all that much to add. I think that Amber and Lina really gave a lot of information. I think that the situation that we have with the jails is that there is very few, at least in Alameda, legal ways to hold the jail accountable. Our Board of Supervisors has taken the position that they cannot regulate the jail in any way. I have had a board staff member tell me that the county council has indicated that in her legal opinion, the board has no control over the jail, that they cannot give guidance even by designating how funding should be used. I've asked for a copy of the legal opinion, and apparently it's not even in writing, it's just verbal. So it's not how I read the California Constitution. I think our board is the policymaker for the county. They dole out the funds, they have to approve the funds. And for some unknown reason, they are refusing to investigate and to make the sheriff accountable to the voters. There's not even very much transparency. And I think that's also what makes the jail situation difficult, because it's like shadow boxing. We have to figure out what's going on by talking to individual prisoners, and they only have a small piece of information. There's no way to get an overview of what is really happening. I want to echo what Amber stated, which is that the jail's interest, and particularly Santa Rita Jail, is always just to warehouse people. They're not interested in the actual benefit or impact of the jail on the people they warehouse. And so what we then have is a very expensive system that doesn't have much long-term benefit for anyone involved, except for the sheriff and the deputies, who collect very decent paychecks from doing what they're doing. I think that one thing to sort of note with our jail is that the major services are all for-profit functions. The food is for profit, the medical care is for profit. And when you have that system, then there is a direct incentive to reduce the quality of the medical care or the amount of medical care that's available, as well as the amount of food and the quality of the food that's available. Reading the last contract that I have between the food purveyor and the jail, they're limited to $1.39 per meal per inmate, and that's including all costs, running the kitchen, their staff, and so forth. So the actual food that the inmates get is very little. And one of the things I just want to show you is one of the main contradictions that the prisoners pick up is here they are, they're in jail because they have broken some law or some rule. And yet every day what's being modeled to them is that the jail is above the law and above their rules. So here's a simple example. The jail is required to have a menu. That's a state regulation. And they don't hand out the menu, but we've been able to get a copy of the menu. And the menu says basic things like dinner has to have 3 ounces of vegetables, which is a really small amount. But the actual amount that prisoners get is 1.6 ounces. And they know this because they get these little packets of carrots and the label says 1.6 ounces. So here the jail is shortchanging prisoners almost half of their vegetables, and they're getting away with it because there's no way to hold them accountable. So the prisoners then take the position of, it's like, do as I say, not do as I do, that if the jail, which is imprisoning them for breaking the rules, can so flagrantly violate all the requirements that they're supposed to do, what's the point of jail? What are we really having the community learn when the institution that is supposed to be enforcing the rules can so flagrantly break the rules? And I think that that's something that we need to take very, take to heart. I mean, this is what we see in our federal government, that we have a president who says, I can do whatever I want. I can call myself law and order, but I don't have to follow any of the rules. I can break them at will. And that's sort of what we're seeing on a local level. And I know that when I make these statements, the jail goes ballistic and they get really angry at me. But I think that if we have the opportunity, and I hope that we do, that we can take these cases to trial, we will be able to show that on a day-to-day basis, the jail does what it can to get around the rules that it's supposed to follow, and yet it's punishing all the people in custody for having broken those rules, for having broken social rules. So if there's any questions, I'm happy to answer them. All the pleadings are online, and I'm happy to send people links to where the pleadings are or copies of them if people want to see them. Thank you.
Thank you, Yolanda. I want to uplift the point that jails, prisons, ICE detention centers, incarceration, the primary purpose is to punish people, to confine people, to isolate them from resources, and including social resources like their relationships with their family. It is not to heal people. You can't get well in a cell. And so Santa Rita Jail is running exactly as it's intended to. So thank you so much to all of our speakers, Sheila, Lina, and Yolanda. As we have collectively made clear, the health of each of us is dependent on the health of all of us. That was always true, and this pandemic is certainly shining a light on that, almost like running a black light over those connections and interdependence that we have all had with each other all along. The pandemic is, of course, incredibly scary and real. My heart goes out to people who are being directly impacted by this, whether by the virus itself or the conditions that are coming out of the virus, like unemployment. And we really want to be clear that this pandemic is giving us an opportunity and an imperative to reevaluate how we handle social, political, economic issues in Alameda County and beyond. County officials can choose to invest in health-affirming resources like housing, healthcare, food, instead of harmful systems like incarceration. So we really must immediately release people from Santa Rita Jail and connect them and their families who eagerly await their return with community-based resources. This is why Decarcerate Alameda County's core demands are to free people from Santa Rita Jail, divest from incarceration and policing, and invest in community health. So I just want to take a second and see if there were any questions in the YouTube comment thread or in our Zoom. It appears not, which I will take to mean that we have done a very thorough job of going over what is going on. Okay. So looking like there are no questions, I want to thank the Decarcerate Alameda County members for all of their back-end support. This was a major team effort, even though you only saw 4 faces. I see there's a question, so I'm just going to finish these thank yous real quick. I want to give a special shout out to Ashley, Norma, Jose, Tash, Alex, Casey, Darby, Sarah, probably others I'm forgetting, Terrence, for everything that you're doing to move this press conference online and to move the work forward in general. I'm gonna wait and see what the question is. Okay. This one's for Yolanda, I think. Could you share more about the limitations in the county that make it challenging to hold Santa Rita Jail accountable from a legal perspective? And I have a thought on that as well, but I'll turn it to Yolanda first.
Can you say that again real quick, what the question is?
Could you share more about the limitations in the county that make it challenging to hold Santa Rita Jail accountable from a legal perspective?
Well, the difference is that I don't believe there should be limitations on the county board holding the sheriff accountable. I read the California Constitution as saying that the county board sets the policy. They can't go in and tell the sheriff how to police, but that limitation doesn't apply to the jail. And the county board has taken the position that they have to have a complete hands-off approach. The state Senate, the state legislature just passed a law which allows the county to appoint an inspector general and to appoint and to set up a review board for the sheriff's office. And I think that that's in response to many counties saying, oh, we can't hold the sheriff responsible. And I think that's wrong. But now they have been given the statutory authority to have someone do oversight. So I know that there have been local organizations that wanted to, at the very minimum, do an audit of the sheriff. You know, how is he using his money? Is the money being used in a good way? I mean, it's an enormous budget. I think it's like 30% of the entire county budget. And they're constantly coming to us and saying, oh, we need money for Head Start. And I'm an Alameda County taxpayer. We need money for preschool, which is all, we need money for healthcare. We have a terrific and terrible homeless crisis in the county, and we need more money for that. And yet the board says we don't have the authority to review how the sheriff spends his money. So these are some of the problems, which I think is an abdication of their elected responsibility, that they're signing the checks for the sheriff, but saying we can only sign the checks. We can't even deny the sheriff the funding, and we can't tell us how you use the money. So that's a very basic situation. That's like, we have to write the check, but we can't say, where's the money going and how's it being used? So that's a very basic issue. The second thing is, for example, the county is a sanctuary county. People are not supposed to be turned over to ICE. And yet the sheriff has clearly admitted that when he feels like it, he turns people over to ICE. He calls ICE, they come pick him up, you know, and he feels he has the right to do that. Now, why is that? Why is he above the basic policies and laws that the board passes on how our county is supposed to operate? No one else gets to do that except the sheriff. So this highlights my prior point that the sheriff is enforcing the law, and yet he holds himself above the law. And that's, to me, an inherent contradiction that doesn't work. So those are two basic issues, that there's no way that the county feels they can hold him accountable.
Thank you, Yolanda. Lina and Sheila, I don't know if you wanted to comment on that as well. I don't believe either of you are lawyers, but you might have thoughts on the legal angle or other thoughts on this question, and no worries if not. Okay. All right. Yes, I want to uplift the point that the Alameda County Board of Supervisors have budgetary control, which is a huge lever of accountability and a determination of how well resourced the sheriff's office will be. In 2021, for example, the operating budget for the sheriff's office is at least $458 million. That is what's allocated to the sheriff's office alone, though we know that the sheriff's office also receives pockets of money in other departmental and agency budgets. So that's just what's earmarked under the sheriff's office specifically. And of course, as Yolanda mentioned, we are struggling under a tremendous housing crisis and a need for healthcare and other services like preschool for folks. So how differently could we spend that money? And that is entirely within the Board of Supervisors' purview. And they would not even be going out on a limb as the first county in California. We've seen Los Angeles County, for example, use the power of the purse to hold their sheriff's office accountable. So we're not asking the Alameda County Board of Supervisors to do anything that is outside of their statutory authority, or even something that is outside of the realm of what has been done before. So I see, Yolanda, you have your hand raised, and I see a note in my chat from Lina as well. So Yolanda, did you want to add something?
I want to add one other point, and this has to do with the sort of like the cultural and philosophical orientation of Gregory Ahern, who's the sheriff. If you go online and you read his bio, he's very proud of the fact that he has a BA in business from St. Mary's. And so the jail is run as a very strict profit-making organization in which he tries to minimize every dollar he spends on inmate services. And that's part of the conflict. So for example, I've sued the sheriff at least twice over the fact that over the years he refused to provide women with sufficient menstrual pads. He would count it out, you know, and every woman out there knows that 2 pads a day is not enough. And so we had to sue him twice because he wouldn't do it. And it was definitely a cost issue that he wanted to save the money. He accused women of wasting the pads, of using the pads for other things. I have seen those pads, they were very thin. And a lot of women need more than 2, sometimes more than 2 at a time. So what you have then is, for example, when there was programs and classes, the sheriff would not pay for those classes out of his own budget. He got the state of California to declare them as adult education, and got the budget from California's adult education to pay for classes at Santa Rita Jail. And so there's always this nickel and diming of what happens for prisoners. It goes down to really basic things like how often do they get cleaning supplies? You know, all of that costs money, so they limit the cleaning supplies. And that was a huge fight at the beginning of COVID, because we said they need to get cleaning supplies every day. They need to get masks, they need to get wipes. And the sheriff was very reluctant to provide them. So this is where a lot of the policies in the jail is driven by the way the dollars are allocated. And I think that what is clear from looking at the overall budget is that the sheriff's salary budget has ballooned, whereas the actual budget for services to prisoners has decreased. And at the same time, the number of prisoners in custody has drastically been reduced. So it begs the question, if you don't have as many people in custody, why is it that all these deputies are on mandatory overtime? Where is this money going, and how is the money being allocated? And it's sad that there are no such answers in Alameda County, because the Board of Supervisors refuses to ask those questions and to have the sheriff provide them and the public with those answers.
Thank you, Yolanda. Correct me if I'm wrong. I found this, I'm remembering a small anecdote that when there was the lawsuit about gender discrimination because of the lack of access to menstrual products, that the sheriff's office actually claimed it was not gender discrimination because they did not provide menstrual products to anybody, regardless of whether they menstruate or not, and therefore it didn't qualify as gender discrimination. Am I remembering that right?
That was my litigation. They hired outside counsel who made that really bogus argument, which infuriated me. But it took a lot of litigation to show that that's not the definition of gender discrimination. That's like saying, you know, we're not going to cover pregnancy in healthcare because men don't get pregnant. You know, that's not a basis for, I mean, that's what Ruth Bader Ginsburg did for us. And I want to thank her for that, because that was the argument for a long time. And I think that the sheriff does not represent the values of our community.
Yeah. Yes. And I want to uplift one more connected dot to something that Sheila said earlier. Of course, you know, this is a systemic and structural issue. Gregory Ahern, the sheriff of Alameda County, is a particular manifestation of this systemic and structural issue. And I don't want to contribute to an idea that it's just about him, because this is a structural problem. But when there was the story breaking, I think it was around the woman who was forced to give birth in solitary confinement in Santa Rita jail. And the reason she landed into solitary was because she was in labor. She was very, very pregnant. She was in her 3rd trimester and she was having contractions. She was in labor, and she reported this to the deputies, who believed she was lying. And as punishment, as retaliation for said lie, they put her into solitary confinement where she gave birth, and the doors were not open to her cell until they could hear her fellow incarcerated people could hear the baby crying and demanded that the door be opened. And when this story broke, it of course made a very large splash. And news reporters went into the jail to film what was going on and talk about some of the ongoing issues. And Sheriff Ahern, on video, called everybody who's incarcerated pathological liars and called everybody really terrible names, which reveals a lot about the way that he thinks about incarcerated people, and which of course has implications for the policies and protocols inside the jail. And makes me think about, if this is what he's saying on a news broadcast where there's a giant camera and a microphone in his face, what is he saying behind closed doors? This is him on his best behavior. He knows this will go into the public eye. And yet, despite all of his media training, this is what he chooses to put forward in the public. So we can only imagine what is happening in his closed door private meetings, which of course then yields the conditions that folks have been highlighting here today, and connects to what Sheila was talking about, where her friend 20 years ago was complaining of gallbladder pain or some kind of internal pain that was actually requiring of surgery. And yet the jail staff believed that that person was lying. So I want to turn to Lina, who has a note on the funding piece as well.
Yeah, I wanted to add that the sheriff also does receive federal funds, and one of the sources of federal funding is to house people who are federal cases. It's a contract with the U.S. Marshals, right? So the sheriff is receiving federal funds, and yet our understanding, based on conversations with people in Santa Rita jail, is that the jail is absolutely not meeting federal standards for accessibility, like Spanish and other language translation, as well as disability accommodations. I think Yolanda might be able to say more about this as well. But we have spoken to people who've been unable to receive language accommodations. We've also spoken to people, incarcerated people who have been put in a position where they have to translate for people in their unit. And one woman told us when she asked a deputy to please translate for a woman who is a monolingual Spanish speaker, the deputy's response was, "They don't pay me to translate. I'm not going to do that."
Thank you for uplifting that, Lina. Okay, I'm not seeing any other questions, and I do want to respect folks' time, so I'm gonna close us out unless anyone has any last burning things that I'm missing. Okay, so as you can see on the slide that is up, we would like to encourage folks to join us to support Decarcerate Alameda County's work to free people from Santa Rita Jail, divest from incarceration and policing, and invest in community health. You can contact us through any of the channels that are on the slide that is up. We have a website, decarceratealameda.org, an Instagram, free SRJ, SRJ of course being Santa Rita Jail. We have a Twitter, Decarcerate AC, AC is Alameda County, and a Facebook, which is Santa Rita Jail Fail. And with that, we will maybe leave this open for just another minute in case folks want to grab the handles that are on the slide, but otherwise we will be posting updates on our website and social media, and look forward to being in contact again soon and seeing some immediate action from Alameda County officials to address the harms of the outbreak inside the jail and the implications that has on the whole county as well. Thank you so much for joining.